Hey there, it's Lowell Wild Jr. So some interesting things over the last couple of weeks came about. A couple of weeks ago, I was in Cabo, Mexico with our mastermind group, and we were talking about the use of regenerative products like amniotic injections and placenta-derived injections. And yesterday, I was meeting with 20 podiatrists around the Chicagoland area about potentially joining the Wild Foot and Ankle Institute. And the conversation evolved into what are we doing for things like plantar fasciitis, Achilles tendonitis, and arthritis, and talking about injections and what would you use. Well, what's interesting is over the last several years, I've relatively abandoned the use of cortisone. And I know that sounds crazy. We're taught to use cortisone. Most of us use cortisone. First visit, people come in with pain and swelling, we use cortisone. But there's really clear research that shows that cortisone has long-term negative effects on tissues and joints. Recently, a study came out that showed that cortisone had significant degenerative effects to knee and hips after a cortisone injection. And so if you extrapolate that data, it would have the same effect to the joints of the foot and ankle. So for me, over the last several years, I have really, for pain with plantar fasciitis, Achilles tendon, and arthritis, I've really tried to move my practice into a more regenerative setting. So I use placenta-derived injections, amniotic fluid injections, and other sparing and regenerative properties. What I have found is that patients not only get similar relief from their pain and swelling as they do with cortisone, but the effects are long lasting and there is not the negative tissue impact that cortisone has. So as we start to look into 2020 and beyond, we really need to think what's in the best interest of our patients. Is it just getting them better for 6 weeks? Or is it about healing their tissue, providing regenerative properties to their joints and tissues for the long-term benefits of the patient? So as you start to look at 2020 and beyond, you should start to try to evaluate that and incorporate that in your practice. Patients are looking for this. I promise you, patients are looking for this, and they're looking for the alternatives other than the typical cortisone injections, with the internet and Dr. Google providing so much of that information. So as you look forward, look at those regenerative medicines. And these are the types of things that we talk about and so much more at the FABI event, which I'll remind you is March 13th, 14th, and 15th, 2020 in Miami. Have a great week.